The Lazarus reflex is a truly fascinating yet often unsettling phenomenon. It can occur in patients who have been declared brain dead. Imagine a patient confirmed to have no brain activity suddenly making movements. These movements might include raising their arms, perhaps even crossing them on their chest. This can be deeply shocking for anyone witnessing it, especially family members. It is named after Lazarus, the biblical figure whom Jesus is said to have raised from the dead. However, it's crucial to understand this reflex does not signify a return to life or consciousness. It is a complex series of movements triggered by the spinal cord, not the brain, which has ceased to function. Brain death is a profound and irreversible diagnosis. It means the entire brain, including the brainstem which controls vital functions like breathing, has permanently stopped working. There is no blood flow to the brain and no electrical activity. This is different from a coma or a persistent vegetative state, where some brain function might still exist. Once brain death is confirmed through rigorous testing, it is legally and medically accepted as death. The Lazarus reflex, therefore, happens in a body that, by all medical standards regarding brain function, is no longer alive. This distinction is absolutely vital for everyone involved to grasp, helping to prevent false hope. The movements associated with the Lazarus reflex are not purposeful. They are not an indication that the patient is aware, feeling, or attempting to communicate. Instead, they are automatic responses generated solely by the spinal cord's remaining neural pathways. Think of the spinal cord as having a limited capacity for independent action, much like a chicken can still run briefly after its head has been cut off. This analogy, while stark, helps illustrate the concept of spinal autonomy. Understanding this helps us separate the reflex from any notion of miraculous recovery or a misdiagnosis of brain death. It is a physiological event, not a sign of returning consciousness. So what exactly is happening when these movements occur? The spinal cord, even after the brain has died, can retain certain reflex arcs. These are simple neural loops that don't require input from the brain to function. The Lazarus reflex is a more complex version of these spinal reflexes. It is a testament to the intricate design of our nervous system, where some functions can be localized and operate independently, even in the most extreme circumstances. This understanding forms the basis for demystifying these movements and providing clear, compassionate explanations to grieving families and even healthcare professionals who might be less familiar with the phenomenon. The physiological mechanism behind the Lazarus reflex is rooted in the spinal cord's ability to act independently of the brain. Specifically, it involves what are known as spinal reflex arcs. When certain stimuli are applied, sensory nerves carry signals to the spinal cord. Within the spinal cord, these signals can directly trigger motor neurons, causing muscles to contract and produce movement. This all happens without any involvement from the brain. The brain's role in processing information and initiating voluntary movement is completely absent in a brain-dead patient. The Lazarus reflex is a stark example of this preserved spinal cord functionality. Medical understanding points to specific segments of the spinal cord being primarily involved in generating these particular movements. These are typically the cervical segments C5 to T1. These segments of the spinal cord contain the nerve pathways that control the muscles of the arms, shoulders, and upper chest. Therefore, the characteristic movements of arm flexion, adduction, bringing the arms toward the body, and sometimes even a brief raising of the torso can be explained by the activation of these specific neural circuits. The complexity of the movement can sometimes appear coordinated, which adds to the distressing nature for onlookers, but it remains a purely reflexive action. Various stimuli can trigger the Lazarus reflex. Often, it is observed when a patient is being disconnected from a ventilator. The change in oxygen levels or the physical manipulation involved in this process can be enough to set off the reflex. Other triggers can include passive movements of the limbs, touching the patient, or even changes in carbon dioxide levels in the blood as respiratory support is withdrawn. The movements usually occur a short while after the stimulus. They can last for a few seconds and might even repeat. It is this responsiveness to external factors, however minimal, that can make it so confusing for those unfamiliar with the underlying science. It is essential to reiterate that these are not voluntary actions. The patient is not trying to move. The spinal cord is simply reacting in a pre-programmed way to specific inputs. Think of it like tapping the patella tendon below the kneecap, which causes the lower leg to kick forward, the knee-jerk reflex. That reflex doesn't require conscious thought. The Lazarus reflex is a more elaborate and, frankly, more dramatic version of such spinal cord-mediated responses. The absence of brain activity means there is no perception, no awareness, and no suffering associated with these movements from the patient's perspective, a crucial point for families. The emotional impact of witnessing the Lazarus reflex on families can be immense and deeply distressing. For loved ones already grappling with the devastating news of brain death, seeing the patient move can ignite a flicker of false hope. They might question the diagnosis, wondering if their family member is somehow still alive or trying to communicate. This can lead to profound confusion, anguish, and even distrust of the medical team, if not handled with extreme care and clear explanation. It is a moment where grief and medical reality can collide in a very jarring way, making an already painful situation even more complicated. Healthcare workers are also affected by these occurrences. While trained professionals understand the physiology, witnessing the reflex can still be unsettling, especially for less experienced staff. Their primary role in these situations becomes one of clear, compassionate communication. They must be prepared to explain to the family, in simple terms, what is happening and why it does not change the diagnosis of brain death. This requires not only medical knowledge, but also significant empathy and patience. Supporting families through this confusing experience is a critical aspect of end-of-life care, ensuring they feel heard and understood during a time of immense vulnerability. There have been documented cases and studies that have helped the medical community better understand and recognize the Lazarus reflex. For instance, a notable paper by Saposnik and colleagues, published in the journal in 2001, reviewed cases and highlighted the characteristics of this reflex. Such studies are vital because they provide data and credibility, helping to educate medical professionals worldwide. They detail the types of movements observed, the common triggers, and the timing of the reflex relative to the cessation of brain function or withdrawal of life support. This documentation helps to normalize it as a known, albeit rare, physiological event post-brain death. These studies reinforce that the Lazarus reflex, while appearing dramatic, is a well-described neurological phenomenon consistent with brain death. They contribute to a body of knowledge that aids clinicians in distinguishing these spinal automatisms from any sign of residual brain function. This is crucial for the integrity of the brain death determination process. The research underscores the importance of thorough neurological examination and adherence to established protocols when diagnosing brain death. By understanding and acknowledging reflexes like Lazarus sign, the medical community can provide more accurate information and support to families facing these tragic circumstances. It is absolutely critical to clarify that the Lazarus reflex does not, in any way, contradict a diagnosis of brain death. Brain death is a complete and irreversible cessation of all functions of the entire brain, including the brainstem. This diagnosis is made after a series of rigorous clinical examinations and often confirmatory tests like an EEG or cerebral blood flow studies. Understanding this reflex is paramount in any medical setting, particularly in intensive care units where brain death diagnoses are made. Healthcare professionals must take the time to explain what brain death means, what the Lazarus Reflex is, and why it does not signify hope for recovery. Using simple language, avoiding jargon, and allowing ample time for questions are all vital components of this delicate interaction. As our understanding of neuroscience evolves, so too should our ability to explain these complex situations. This video is made for educational purposes only. We hope to have been able to shed some light and help in understanding this phenomenon a bit better. Join us and explore our playlists, our informative weekly podcasts, and learn every day. See you next time.